As you know, my name is Alison Magnall and I am your course leader for this module on bioethics and law for healthcare leadership. And today we're going to cover module 2, which is professional values, or more broadly, we'll be looking a little bit at personal values and how the two are interconnected. So to start, we'll just have a recap on the content of module 2. So it's, as I said, professional and personal values, how those values influence our healthcare decision making on a day-to-day basis, how value conflicts can lead to ethical distress and the possibility of lowering the professional standards, and consequences of conflict on health profession and patient care, and subsequently, of course, your organisation. The roles of various healthcare professionals will come into play, and we've got a variety of health professions in the room, so I think that will be an interesting and lively discussion. And how that impacts on coordination of care and creating holistic healthcare. Team working, that's an absolute essential to discuss when we're talking about professional values, because you will be working with many different professions who have different standards, different codes of conduct, etc. And in order to achieve an ethical climate for decision making, it's necessary that the professions come together. Finally, we'll be looking at involving the role of healthcare recipients in making decisions concerning their healthcare. So we'll be looking at how to do that, we'll be looking at consent, information sharing, etc. So I think it's really important to reflect on our course content regularly to make sure that we structure our learning, and also to ensure that we cover all elements. And at the end of tonight's discussion, we'll be going back to make sure that we've covered everything that's in the course content. Okay, so in terms of the learning outcomes, just quickly to look at those. So for each module we have learning outcomes, and we would like to interpret the professional values that influence your professional practice and contribute to your legal and ethical decision making. Now, this will be very much an interactive module, and we hope that we can have some really good examples of how you will make decisions on a day-to-day basis. Also, just to think about, can I just ask the group, is anybody here had to look at their code of conduct that they were working to in the country that they got their profession, that they had their professional qualifications? Have you had to make adjustments with relation to regulations and laws in the country that you're working in? Okay, so at this point I would elicit some information from the class, some examples of where a law might have impacted on their code of conduct or professional values and they've had to make an adjustment. So we would just write that up on the board. And this would also impact on to the next learning outcome. So the next learning outcome would be to identify your professional role and responsibilities in legal and ethical decision making. So we'll be looking at some of the decisions that you've had to make on a day-to-day basis in your workplace, and reflecting on how that made you feel. Were there any problems that make you feel uncomfortable, or did it make you feel empowered and positive? We'll be applying the concepts of collaboration and teamwork. Obviously, that is a desirable outcome, because when an ethical decision has to be made, collaboration is absolutely a priority. And finally, the final learning outcome would be identifying how your values may enhance or restrict you in your work. Again, that would come back to often to local policies, local laws, local guidelines, etc. So any questions so far? No? Okay, good. Okay, so in terms of the professional values, or so-called professional ethics or code of conduct. So in the room we have doctors, we have physiotherapists, we have some pharmacists. So we know that more and more the code of conduct is important, even in things like, for example, building and construction. So each profession should have its own very detailed code of conduct. Okay, so at this point I would just elicit from the staff, from the learners, how they came to know about their code of conduct and how they keep up to date with professional ethics according to their professions. Okay, so we've said that some of you have had to deviate from your professional ethics or code of conduct in your own country, and we've said that that's impacted by guidelines, standards from the environment that you're working in. So the values that we're discussing in professional and personal values are guidelines or standards as to how you behave in your personal life or your professional life. And what I'd like to do now is just have a look at some of the characteristics of professional values. Has anybody got anything they would like to contribute in terms of characteristics of professional values? So at this point, I'd be asking for some examples, and if I didn't get any examples, I would maybe give one example if the class weren't very forthcoming. So my first one would be set by a professional body to use in their daily work. And we already discussed that a little bit further back, where we said, it's according to your profession. So, for example, if you trained in the UK as a doctor, you would be looking at the General Medical Council. If you trained as a nurse, you'd be looking at the Nursing and Midwifery Council. So hopefully the class will come up with some of these so that they're used as a baseline for evaluation of individual performance, and perhaps even as well used to evaluate an organisation. So why I'm saying that it's used to evaluate an organisation, an organisation might like to be able to say, we have X number of doctors who have trained in the particular country, so South Africa or Australia, and this is their code of conduct, and they are then able to uphold our standards and policies and our standard of care. So characteristics of professional values. The final one I've got here is to help identify the profession and inform others of the expectations of that profession. So who do you think that is important to? Who would like to know a little bit about the profession, that the professional that they're seeing, and why would they have expectations? So at this point, I would hope that somebody would come up with, it would be the patient normally, that would have some expectations of that profession and have an idea of what to expect in terms of standards. I'd like you now just to discuss amongst yourselves, so if you could work in pairs to look at some of the further features and characteristics of your own professional values or code of conduct that you would be used to working to in your own country, and in addition to that, any elements of a code of conduct that you might have added to whilst you're working in another country. So, and what influenced that change. So it would be great if you just spent 5 minutes discussing amongst yourselves, and then we'll take some feedback from the group. Okay, so that would be a 5-minute exercise. And you will be able to take these slides away with you. I've just put one article at the bottom, which is the importance of professional values from clinical nurses' perspective. So it is a very important topic to help maintain professional standards. Okay, so how do we acquire our professional values? Okay, do you think that they're linked to personal values? So the influences on personal values are fairly obvious: family, culture, environment, religion, ethnicity. Has anybody got any other examples of what influences their personal values? Okay, so I'll take some feedback from the group. I think it's important to think about how we acquire our personal values. So personal values are acquired gradually throughout your lifetime. So, we could argue that as we become older, our personal values become more entrenched, or we have a stronger personal profile in terms of sticking to our values. Would anybody like to comment on that from their own experience? So I might take some feedback from the group at that point as regards the influence of time. So if somebody comes out of university at 21, how have their personal values been affected? Okay, so the acquisition of professional values is also gradual, but that's over a shorter time frame. And it would be quite good then to broaden out the discussion just to see if people's values did change during the time that they were having their professional training. Okay, so can a profession change our personal values? That is one of the questions that I would like to pose to you. And I would probably write this on the board and we could brainstorm on that point. When I've finished that little exercise, I would look at the final point. So it's possible that you based your choice of profession based on your personal values. Would you like to, anybody like to comment on that? Do you think it's true? Now, many of you, when you were, right from the time you were very small, would say, I want to be a doctor, I want to be a lawyer, I want to be a fireman, etc. You have something in your mind that you want to be, and it might be that your family quite strongly drove you to a particular profession because that was their profession and they knew that they had enjoyed it. So let's just take a couple of minutes to reflect on that. So the two things that we're looking at here are, did your professional training change your personal values? And is it possible that you based your choice of profession based on your personal values? And that might be something that you want to think about in terms of one of your assignments. Okay, so looking at personal values, now go back to personal values. These are just few examples of some personal values. And I want to continue looking at the link between personal values and professional values. At this point, I would ask the class then to perhaps put some more circles in there to look at some more personal values, because it could be a huge amount of personal values that you remember that your parents taught you or your grandparents taught you, and this was very important to your family. So I think it's important to pause here to look at personal values in the group, and probably would get them to do this in pairs and feedback to the whole class. So write some of these on the board. And then move on to professional values. So, okay. So here we can see the links between personal and professional values. So it might be that transparency in personal values is more likely to be called honesty and sincerity in personal context. So we could debate many of these words. So authority, in the professional sense, that seems like quite a good value. However, in a professional sense, is there any way that you could think of authority as perhaps being negative? Okay, I would hope in that some people would see that authority possibly could have some negative connotations as authoritarian or reliance on authority. We could debate some of the other values that people have brought to the table in terms of whether they could be negative or positive. But what I'd like to, when I go back to the group to discussion, I would like to use some phrases rather than single words to work through some examples. So how would, for example, empathy translate into action in the workplace? How would transparency translate into action in the operational setting in the workplace? And I think that reliance on single words, I would like to advise people to not to over rely on single words and to focus on the broader definition and the broader meaning and the broader application. Okay, so I think I've probably covered 20 minutes there, nearly 20 minutes, because during that time, I think to get the feedback from the class, to do the brainstorming, to do the group work, and to elicit some of the answers, and to for them to have their interactive session would probably take 20 minutes. But just to continue with the next couple of slides, I would like to look at decision making, and this goes back to some of the course content. So I would like for us to discuss how our values could have positive impacts on our decision making. So how values influence healthcare decision making. I'd like to make this a sort of fairly concrete exercise where we would come up with some examples, perhaps related to a particular scenario in healthcare setting. So perhaps in a meeting, for example, looking at something like strategic objectives or policies. So decision making, it'd have a number of key players, who those players are, what their professional values are, and how their personal values might have impacted on their professional values. And finally, I'd like to look at the previous slide, looking more at the positives. I'd like to have a positive focus there. So conversely, there might be some downsides in terms of value conflicts when making decisions in the workplace. And again, after we've done the first exercise, I would like to look at the statement, value conflicts can lead to ethical distress. I think it's important not to have something with a negative too early on in the class. And I would also like to look at how value conflicts can lead to lowering of professional standards and why. At this point, I might give some examples of my own examples of how, when working in a multi-professional group, there are conflicts. People want to have something at a lower standard or follow a guideline that you would not want to follow. You would want to follow something of a higher standard, and how you deal with that, how you deal with these conflicts. So that's my presentation, and I'd like to thank you for listening.